Hi there, I'm Dr. Emily Lamb. I'm a psychiatry resident. I'm in my second year of training here at West Virginia University Ruby Memorial Hospital. If your kid is going back to high school this fall, it can be a really stressful time for you and for them. Something that I would recommend is finding an opportunity to make your home a safe place. Make your home a place that is not as stressful as school, right? We want our homes to be a place where our kids can come back to and relax and know that they're safe, regardless of whatever's going on in the world or in their high school. How do you do this? So something I would recommend is try to create space and time where you're able to talk about something with your kids that's not school related. Maybe this could be a family dinner once a week. Maybe this could be making food with your kid, meal prepping with your kid, and focusing on what you're doing and those things rather than focusing on how is school going and asking a bunch of questions that can be overwhelming and kind of anxiety producing if your kiddo is already struggling with feeling all that anxiety at school. Another piece of advice that I would give to parents, especially our parents who are trying really hard to set their kids up for success, is to pay attention to the ratio of criticism or feedback that you give your kid versus the praise or the "that was awesome, you did a really good job" kind of things. And so when we think about the ratio of those things, aim for a ratio of 7 praises, 7, you killed it, you did an awesome job, to 1, let's work on this, right? So we want to make sure that we are showering our high school students or our teenage students in affirmations and letting them know that they are capable and they are strong, and encouraging them to become more autonomous from a place of empowerment rather than you really need to work on this. And so not only is that hopefully going to help them thrive a little bit more, but hopefully it'll help the dynamic and some of the anxiety and tension that can come along with your child getting older and getting more independent. Speaking of independence, this is a really awesome time to focus on transitioning and letting go of some of those reins. Depending on how old your kid is, how mature your kid is, it's gonna look different. Some places to start are helping them manage some of their laundry, some of their food, right? Helping them learn how to cook. Another step forward would be helping them manage medications, right? You don't want them to walk out your door and not know how to call a doctor or what the difference is between insurance and primary care and all those hard things. And so slowly letting go of those reins and kind of watching and monitoring as you're able. The other thing I would recommend is just keeping conversations open. Ask open-ended questions and see where they take you.